We have a huge problem within musculoskeletal medicine in terms of capacity. That, coupled with the changes and challenges within primary care, has meant we've got to look at a broader workforce, and therefore building in the allied health professionals into primary care has been put forward as one of the mechanisms that might support GPs in the long term, but most importantly improving the patient experience within their musculoskeletal pathway.
A first contact practitioner is somebody that is based usually within a GP practice. A patient will ring the GP practice, and instead of going to see a GP, they would come in and be booked directly in to see one of my team. They would be assessed and given the appropriate advice and guidance about how to manage their problems, so that they're getting knowledge about how to self-manage right from day one. It very quickly became evident that this was a very successful service. So we created this accelerated learning programme for some of our band 6s and 7s. The idea was always to train them up to an 8A capability.
So my name's Laura. I'm going to be carrying out your
We started our first contact practitioner programme in January 2015. It was a true first contact practitioner role, really, in that we did a lot of work with the receptionists in all our GP practices that were involved in the pilot, and advised them that if a patient rings you and says my problem sounds musculoskeletal, they were to offer booking them in with us so that they saw the first contact physio instead of being put on a GP list.
During that pilot we could clearly see there was data coming back through the reports to advise that this was something that could make quite a difference. For example, the number of requests for investigations around plain X-ray reduced by 5.9%. During that period of the pilot. Equally, MRI requests also reduced by 4.9%. In terms of the initial success rates as well around patient satisfaction, we found that 99% of patients who went through the model suggested that they rated it as good or excellent.
Last summer, Gloucestershire Care Services were invited into a GP cluster locality board meeting. Several of the GPs expressed an interest in some of the models that they'd heard about developing nationally. So they knew that physiotherapists, advanced practitioner physiotherapists, were starting to actually work out in primary care, and actually working with Gloucestershire Care Services as a host provider could give some more governance assurance as a pilot.
What we've contracted is a 52-week service. We have the advanced physiotherapist practitioners working daily across the 5 practices. We're lucky enough to be in one building, so they stay in the same building, but they work in each practice on a daily basis.
And how are those movements?
The benefits to the primary care team or the practice will be that they know that the physiotherapists, the advanced physiotherapists that they are employing, their competencies they know will be assured.
I don't think first contact roles are going to disappear. I think the demand for them is going to increase, and I think having trained staff that are ready to go has to be the way forward.
The cluster pilots that we're running at the moment, I think, have been a fantastic opportunity for us to really build up closer relationships and closer working with primary care. There's a real role within community organisations and community services to work more collaboratively, and we found that the clinical pathway for patients, the benefit for patients, is significant when you actually work collectively, collaboratively.
Okay, and then if you can turn
The first contact practitioner role has been a real boon to our service. It's freed up our pathways across musculoskeletal care. The other thing that we know is it's a really safe service.
Good, and relax.
It gives your patients an opportunity to access services much sooner in their journey, and it helps your GP colleagues free up some of their time for what's more appropriate for their caseloads.
We have to be transformational in our workforce redesign, think differently about using what we currently have in a more effective and economic way.